Now, from CBS News Miami, this is Facing South Florida with Jim DeFede.
Welcome to Facing South Florida. I'm Jim DeFede. Earlier this month, the Miami-Dade County Commission voted to end the process of adding fluoride to the county's drinking water. Mayor Daniella Levine Cava then vetoed the measure, and in 2 weeks, the County Commission will have the opportunity to override that veto. Now, attacking the use of fluoride in drinking water has become a cause for those on the far right who have made it part of their ongoing campaign against science. It has been pushed by both Donald Trump and his HHS Secretary, Robert F. Kennedy Jr., and by Ron DeSantis and his Surgeon General, Dr. Joseph Ladapo, who showed up at the commission meeting to speak on behalf of the anti-fluoride bill.
So if you, as the leaders of this community, make the decision to continue adding fluoride to water here, you have to believe one of two things. You either have to believe that all of those studies, all of the researchers, all of that work is wrong, incorrect, that there are no harms, or you have to believe that you are comfortable potentially harming some people in your community. Some of that research is right, but you are comfortable adding something to the water that could potentially hurt some of the people in the community, particularly children and pregnant women.
To be clear, the majority of studies have found fluoride to be safe. Now, there are studies raising questions about the possibility that high levels of fluoride can have an adverse effect. Yes, there are those studies. However, those studies are far from conclusive, and many scientists have questioned their results. But what Ladapo is doing with fluoride is the same thing he does with vaccines: raise enough doubt to scare people and label it as prudence. This week, I spoke to Ron DeSantis' first Surgeon General, Dr. Scott Rivkees, who was sidelined by DeSantis for presenting the facts during the pandemic. He is now an Associate Dean at Brown University.
Where you have fluoride supplementation in the proper range, you decrease the levels of cavities that children have by about 50%. And the evidence is also pretty clear that it is very safe when it's used in proper levels. So in terms of the comment from the mayor, where she said that ending fluoridation would have real and lasting harm, especially for children and families who cannot afford regular dental care. That is absolutely spot on. And the other issue, which really goes hand in hand with this, is dental care and dental access. More than half of the children in Florida are on Medicaid. There's a real shortage of providers that will provide dental care for children who are on Medicaid and also for children who are not on Medicaid. If you are going to say we want to get it out, and there are some countries that don't have fluoride in the water, you have to provide reasonable alternatives in terms of what children are going to be able to do for the benefit of their dental health.
So the notion of removing fluoride or severely limiting fluoride at the same time, while you're not providing the dental services that children need, that's sort of like a double whammy against those kids, isn't it?
Yeah, absolutely. It's very much unfair to children. Again, information available out there show that you can reduce the number of cavities that children have substantially. But, Florida is really impacted by the shortage of dentists who will take care of children, and especially the number of dentists who will take care of children who are on Medicaid. So, if you're going to address this issue and you're going to say we're not going to have fluoride in the water, that we're going to accept children having more cavities as the new normal, we have to be able to provide preventative strategies and also additional treatment for these boys and girls whose teeth are going to suffer.
This gets to the larger issue, which you and I have spoken about over the years, which is the attack on science, the notion that scientists and studies can't be trusted. Talk a little bit about what you see, how that relates to this argument that we're having now.
Yeah, I mean, this is part of a bigger conversation that we are seeing now, where we're seeing politics and ideology replace fact and science. And we're seeing this spill over in many different areas. So, for example, let's look now. What's happening with measles in the United States? There are probably more than 1,000 cases of measles in the United States, 800 reported, but probably at least double or triple number of that cases which is not reported. We never had this before. The number of children who are being hospitalized for pertussis, also called whooping cough, is really very high, something that we have not seen before. And the reason that we are seeing this is because there is a movement afoot, basically trying to discredit vaccines and take away standard public health measures which happened to work before. So again, when we start replacing medical practices with politics and ideology, individuals are going to suffer.
As you've watched what's been occurring at HHS, what's your reaction to it?
Yeah, well, it's unfortunate that, first in terms of what Health and Human Services do through the Center for Disease Control, through the NIH, CDC works to keep us healthy. It protects us from infectious threats, protects us from other kinds of things, tobacco-related problems, mental health-related problems. Uh, in terms of what NIH does, NIH provides tremendous amount of research support, which leads to development of new cures, new therapeutics, and just basic understanding of science. And what we're seeing now is that a major philosophical shift so that CDC and NIH, a large part, many of the programs are now eviscerated. HIV is still a problem in the United States. Florida, in fact, typically will have the highest number of individuals diagnosed with HIV per year. So we've seen CDC programs related to HIV going away. CDC programs that focuses on asthma prevention going away. Tobacco control programs going away. Worker safety programs going away. There's so many aspects that CDC did quietly behind the scenes, trying to keep us all healthy, programs which are now gone. And then in terms of the impact on scientific research in this country, right now, about $40 billion of CDC funding goes to support research laboratories all across this country, including Florida. And what is proposed is that this number will cut by a half, which is going to have broad impacts on our country's ability to lead science in the world and lead to new discoveries and cures.
I think through the DOGE cuts, they're planning on eliminating 20,000 positions at HHS, which would have a dramatic impact, obviously. Uh, but I do want to note, I do think HHS and the new secretary, Robert F. Kennedy Jr., is trying some good things. It's the scale of the bad that he's doing at the same time that is problematic. But for instance, this emphasis that he wants to do on keeping Americans healthier. Uh, and I know that I believe it was the FDA commissioner this week who also announced removing some dyes, red dye number 3, red dye number 4 from food products.
Yeah, so I think we have to separate sound bites from true action. It's great to say we want to keep America healthy and address chronic diseases. Chronic diseases are a huge, burden on individuals. Heart disease, diabetes, obesity, lung disease. A lot of this really happens to do with access to health care. These are very complicated issues. We know that society, where we live, the environment around us influences our health. So, how, on one hand, are you going to sit there and say that we want to fight chronic diseases, whereas on the other hand, the federal government is decimating the programs related to environmental safety and quality? We know that asthma and lung disease, that particulates in the air pollution are a factor. So we can't, on one hand, say that we want to decrease chronic lung disease. On the other hand, allow levels of pollution to be able to go up. We can't say we want to address obesity, other kinds of diseases. On the other hand, when we don't make access to health care for all of us free and freely available. So in practice and in theory, it's great. It really has to do what is going to be in the operations to allow us to continue to address these issues.
One last point about fluoride. The Florida legislature is also considering a statewide ban on fluoride. We'll keep you posted on that as well. When we come back, we'll continue the conversation about what Donald Trump and Robert F. Kennedy Jr. are doing to the Department of Health and Human Services. I'll speak to Donna Shalala, the HHS secretary, during the Clinton administration. Stay with us. Welcome back. One of the areas hardest hit by Elon Musk's DOGE effort is the Department of Health and Human Services, which operates everything from the Centers for Disease Control, the Food and Drug Administration, and the National Institutes of Health. At least 20,000 people have been fired, and hundreds of millions of dollars in grants and research, including tens of millions of dollars slated for Florida universities, are being eliminated. Now, before she was a member of Congress or the president of the University of Miami, Donna Shalala served 8 years as the HHS secretary under Bill Clinton. I asked her this week for her reaction to what is happening at HHS.
You know, these cuts are reckless. They're not targeted. There are ways to reduce the size of government. We did that during the Clinton administration without laying people off, with minimal reorganization, because we were focused on saving lives. The problem with these cuts is they put America's health at risk. They put our economy at risk. There's nothing that drives the economy more than the NIH investments. It's not just the personnel at NIH. It's the investments in the future, the discovery of new drugs, the discovery of cures, and to recklessly cut across the board NIH is just a disaster for this country and for our future.
I think we're looking at close to 20,000 people being fired or laid off from HHS, including 6,000 new employees that were coming on, theoretically to replace retiring employees, probationary employees. And when you do that sort of wholesale cutting, as you sort of said, you end up hurting significant departments within the agency that are no longer able to completely do their work. Are there any particular areas that you've seen that's been noted that from your experience that draws real concern for you?
Well, first the NIH cuts, which I believe are a disaster. But then you look at the CDC, the group that goes after some of these measles. And by the way, we're having a measles epidemic in this country. And what's going to be next? Polio? By people that are not getting their vaccines for their kids. And so the fact that we have not been able to contain the measles epidemic, it may well lead to other diseases. These outbreaks are very dangerous for people in our country. They're dangerous for those who are too young to be vaccinated, as well as, more significantly, those that have not been vaccinated. And the new secretary of HHS has sent mixed messages about vaccinations.
Well, let's stay with that for a second. I was going to go to another area, but let me ask you about the appointment of Robert F. Kennedy Jr. to be the HHS secretary.
I think he was anti-science, anti-government, and had absolutely no experience managing a large, complex institution. If you look at all the previous Republican that have headed HHS, look at Mike Leavitt, who was a governor, at Tommy Thompson, who was a governor, at Alex Azar, who had ran a major pharmaceutical and had been deputy secretary at HHS under Bush. These Republicans had had extensive management experience, were pro-science, were pro-vaccines, but also served the American people in a different way than the Democrats did. They did not believe in larger government, but they did believe in science. And they're in investments, for example, Alex Azar in Operation Warp Speed saved millions of lives. We now have a secretary who is actually putting at risk millions of lives.
He claims that his focus is now more on making America healthy again by focusing on a healthier lifestyle for Americans. That may be admirable, but your reaction to what he's trying to do?
There's nothing wrong with those as goals, but in the process, you don't eliminate the underlying science and the underlying programs. For example, the AIDS programs. Miami is number 2 in the new incidence of AIDS and HIV. We need those programs for prevention, but also for discovery. We still have a lot of work to do on AIDS. He allowed the president and encouraged the president to eliminate the relationship with WHO. Diseases don't know what boundaries are. We need the WHO to help prevent disease around the world that may eventually end up here in the United States. Most recently, NIOSH, the National Institute for Occupational Safety, they're going to eliminate that agency. That's the agency that reviews and does research on occupational safety. We don't need, as the supposed expansion of manufacturing goes on, we don't need more people getting accidents. And that has been a traditional role of the federal government. And now they're talking about Head Start. Who eliminates Head Start? Millions of kids have had that child care program. We introduced healthcare into it. It's an extraordinary program that's made a difference for low-income kids. So what they're doing is reckless, and it's not going after waste, fraud, and abuse. As far as I can tell, Jim, all they're doing is abusing federal workers. The waste and fraud has not been eliminated. You need an IG who they've fired. You need the FBI unit, and you need the Department of Justice to focus on waste and fraud.
Michael Lewis, the author, has a new book out where he focuses on government workers, who I think are so maligned as just sort of being this lazy, malevolent force that wants to interfere in our lives. But Michael Lewis shows how most workers who work for the federal government do it out of a sense of commitment and wanting to try to make things better, as particularly in the areas that you dealt with HHS.
I believe the government workers, they're public servants, they're patriots. They want to make life better, not only for Americans, but for people around the world, both in the health area and the welfare area. They settle refugees. They do research on science. If we didn't have the vaccine center that was started during the Clinton administration, we would not have been able to solve the COVID vaccine issue decades later. So it's that original research that makes a difference. Every single one of those scientists could make more in a university. Or in a private sector research lab. But they're dedicated and they work every day. They work 24 hours a day. They work long hours wherever they are in a place like Health and Human Services. The FDA makes sure the drugs that we take are safe, and it is a signal for the world. Many countries don't have an FDA, but they take the recommendations of the Food and Drug Administration.
When you look at the FDA, the CDC, all of these agencies, there was one, the Administration for Community Living. It's got an innocuous name, but it actually plays a central role for so many older Americans in this country.
Here's what we learn about healthcare, that you have to have wraparound services. You have to worry about housing, you have to worry about nutrition, and improving the quality of life for our senior citizens means more than Social Security, which they're attacking, by the way. Try to call the Social Security office in Miami, and you'll be lucky if we can get through. And I tried the other day, and the wait was enormous. And I was trying to do it for a friend, and we never did get an answer. But for seniors, for the disabled, for the poor, We need wraparound services, and that's what community living does.
I want to shift gears for a second and talk a little bit about the attacks on universities. You're a former university president as well, working at the president of the University of Miami, before that, University of Wisconsin. When you see what's taking place now with the Trump administration going after Columbia, going after Harvard, what's your reaction to that, and why are universities so critical to a democracy?
Well, first of all, they're the place of creativity in our society. And they're the place where young people come together and meet people from different parts of the world. That's important for an education, whether it's an urban university or whether it's a public university or a private university. But just as important, in every small town in America, there's a college. In most of the cities in this country, there's a university and colleges. These are economic drivers of our economy. If you look at the dynamic part of the American economy, it's this combination of science and technology and universities. No country on earth has the array of public and private universities, small and large, that we have in the United States. These are millions of jobs in our community, but they do have a very important job. They create Americans because we come together with students from different parts of the world, but more importantly, from different parts of the country, from different parts of a community. When I was president of Hunter College, which is another college I was president of, a big urban school in Manhattan, most of the students came from New York, but the students from Queens, from Brooklyn, from the Bronx, from Staten Island had never been to Manhattan. And they came to Manhattan for school, and many of them were new immigrants, and they got a magnificent education. It moved them into the middle class, and universities have always played that role.
The Trump administration has tried to say that the university system has become a breeding ground for anti-Semitic movements.
Universities are very reluctant to arrest their students. There's no question about it. But all of us need to deal with these issues firmly. We need to make sure that our students understand that any kind of discrimination is unacceptable, and making sure that the students understand that there will be penalties if they're unacceptable. The fact is that many of us have dealt with this, have dealt with this due process that you have to put students through. Have we done enough? You can never do enough when you're dealing with discrimination, as far as I'm concerned. But the idea that every university, every college in this country is woke, has no sense of responsibility, does not teach different points of view, is just wrong. I teach with Alex Azar, the Trump first term secretary of HHS. I teach health policy at the University of Miami with Alex. We have different points of view. We want to get to the same place. That is access to health, to high quality health care for everyone. But we come at it differently, and it's important for those students to hear the difference.
We'll be right back after the break. Well, that's all the time we have today. If you have any thoughts or comments, feel free to contact me at jdefede@cbs.com. I do enjoy hearing from you. Now, thanks again for watching, and enjoy the rest of your day.